identify stroke coming into the theatre.
Time is a priority. If you suspect someone's having a stroke, just call 111. On an average day, 1 to 4 or 5 code strokes.
Nothing would move. Well, where's my bloody arm?
This was really quite a shock. We never thought this could happen to our mum.
Every day, emergency department staff at Middlemore Hospital treat up to 5 new stroke patients. Across the country, more than 9,000 New Zealanders will be struck by a stroke each year.
So a stroke is an insult to the brain. It's damage to the brain caused by a problem with blood flow. So it could be not enough blood getting to the brain, often because there's a blood clot blocking blood flow to the brain, or it could be because of bleeding into the brain and damaging the brain. So it's damage to the brain that happens suddenly for a variety of different causes. So the emergency room may have received a call from an ambulance crew saying that they're bringing in a patient with stroke-like symptoms, and the emergency room will activate what we call the code stroke.
Can you open your eyes again? Very good.
What have you found so far?
So far she's got a partial facial droop on the right-hand side. Yes. Can you see my whole face? Yeah. Can you see my finger? Look at my nose. Can you see my finger? Look at my nose. Can you see that? I think feels are okay.
To alert people involved in the hyperacute assessments of patients who've come in with stroke symptoms.
It's vital that anyone who appears to be having a stroke receives urgent hospital treatment. The blood clots that cause a stroke can be fatal, but too few people recognise the signs.
Can you put your hand up in the air? Keep it up. Good. Can you touch your nose? Touch your nose. Oh, very good. Very good. So we're going to get a line in, and then we're going to take you around to the scanner to have a look.
Patients are treated as acute for up to a week, until the medical team is sure their condition is stable. David Maxwell was rushed here 5 days ago.
I fell on the floor, and I fell on this arm. Well, which there was the arm that wouldn't work. I remember my son-in-law lifting me up, and then it was blank. Well, I was amazed. Nothing would move. Like I got on my back, and I tried to slide off the floor, of the bed, and nothing would move. Well, where's my bloody arm? And one arm was working all right, but this damn thing here, my right arm, I couldn't move it. It was so shocking to me.
He's starting to come to terms with the impact.
The common stroke-like symptoms are weakness or numbness, often down one side of your body. So that could be the face, could be the face and arm, face, arm and leg, or any combination of those. Problems with your speech. So that may be slurring of speech, or it may be not being able to get the correct words out or saying incorrect words.
It's hard for anything to get the messages. See, I want to lift it. And then it comes.
When a patient with a suspected stroke comes into hospital, often there are quite a lot of people involved. The priorities are to make sure we can stabilise the patient. So the sooner you treat them, the better their chances of making a good outcome or a full recovery. So time is so crucially important. And there are quite a few different symptoms of a stroke. Often Pre-hospital crews, like ambulance crews, use something called the FAST test. So the FAST test stands for, F stands for face. So if you look at the patients, is there any obvious facial drooping on one side or the other? The A stands for arms. So ambulance crew often get patients to hold up their arms and see if one arm drifts down. The S stands for speech. Is there a sudden new speech problem? And T stands for time to get help, or time to call 111.
A month ago, Iutita Filippo was fiercely independent and living alone. At 76, she's unable to feed herself, dress herself, or speak clearly.
Obviously, she had reduced sensation in her right-hand side. There wasn't much strength in her right-hand grip as well. So with the rehab that we've been doing with her, I've seen it's improved. And I can tell as well by the strength in which she grips, like say the pegs, and also by her reaction that she herself, body language-wise, is able to tell me that there is an improvement and I can sense it in her.
Brain scans help determine whether further emergency treatment is needed to break up the clot.
There are different types of brain scans, but the commonest brain scan that we use is something called a CT scan or a CAT scan. The reason that we do a CAT scan is that we want to have a look at the brain tissue and try and differentiate, amongst other things, is this a stroke caused by a blood clot or lack of oxygen going to the brain?
Eyes look good, so she was following. I had to keep her eyes open. She's got a bit of really luck on the other side. Her eyelids drooped slightly, but when I held them open, she was following the finger quite well.
Brain scans also help us decide whether someone's had a large stroke and whether someone is having a stroke, but the brain is not irreversibly damaged.
Stroke can cause severe and permanent damage to the brain. Delays in treatment impact the long-term disability. The scan of a healthy brain shows a uniform colour and pattern. In this scan, a stroke is evident. It's the dark patch.
Patients may be left with disability or neurological deficits as a result of that stroke, so will require much more intensive input from other specialists, physiotherapists, occupational therapists, speech therapists, dietitians. The list is endless.
Mrs. Filippo suffered a heart attack, then a seizure, and finally a stroke, all within days. Her lifestyle heightened her risk.
Her stroke was a medium to large size stroke, so it was causing her a lot of problem with her weakness down the right side and also her trouble talking, which I think at moments it's still a very big problem for her. But other factors do come into play, such as their age and also other medical conditions they may be suffering from. And you can see here that on the left side of the brain, that it's a little bit darker overall compared to the right side of the brain. Also, we could see on her scan that she's actually had a small stroke in the past, which is over there.
The dark area is permanent damage to Mrs. Filippo's brain. The family was shocked to learn their mother had an earlier stroke that no one was aware of.
She didn't have a history of having a stroke before, so it may have been quite mild or maybe caused no symptoms in her case. And she didn't appreciate that she had a stroke.
If you've had one stroke, you're at risk of subsequent and often more major strokes. Mrs. Filippo was on medication for diabetes and a heart condition before her stroke. But at times she forgot to take her medication, and her children admit none of them eat well.
She suffered high blood pressure and diabetes, from what I know. So it wasn't healthy at the beginning, and it just accumulated to a stroke. There is assurance that it will, from the medical side of things, that it will progress, but it takes time. And we'll be patient. We're just thankful that she's back with us.
The quicker the patient is investigated, including brain scans, the better for the patients. Within the first 5 to 10 minutes of a patient arriving in hospital, it just gives us more information quicker.
1 week after his stroke, Max is moving to the rehabilitation ward. The stroke has affected his right side. His speech is fine, but he gets easily confused.
Welcome to Ward 23.
Thank you, Claire.
It's a pleasure. There's just a bed unmade in his bed space in G2. You just swap it over.
Mrs. Filippo's family visit daily. Their mother's already been here for 6 weeks and faces months of recovery.
It's mentally, physically, spiritually straining.
Yeah, it's been pretty difficult for me in the sense that to see someone close to us, especially one of our parents, in that sort of condition, in that sort of predicament, very difficult.
They're anxious their mother could have another stroke and doubt she can live alone.
She's doing better today.
Anna's an assistant in nursing. She knew her mother's general health put her at risk of a stroke. She wishes she'd intervened. Their mother's loss of speech is hardest to accept. Mrs. Filippo uses facial expressions to communicate.
The gestures and our cultures, everything, the eyebrows, the yes, the no. That's what I reckon the gain from her recognition of faces, familiar, being familiar with people. She might be not able to speak, but her recognizing us kids was a big gain for us. Like, she still recognizes us.
Max is starting daily therapy. Simple exercises replicate tasks you do in daily life.
This is his affected side from the stroke, so his coordination is reduced on this side. So it just takes you a little bit longer to kind of process the same movement on this side.
Of course, being right-handed.
And you're right-handed.
Fixed, yeah.
Because you're right-handed as well, aren't you?
Yeah.
So we want to get that hand moving as best as we can.
Yeah.
Good.
A vegetarian for 40 years, Max thought he had done everything right. But stroke doesn't discriminate who it affects. 75% of strokes happen to people over 65. But doctors are alarmed at the high number of much younger people having strokes.
The incidence of stroke is higher in Maori and Pacifica people, and part of that's probably due to a higher risk of heart disease.
One of the most important factors is blood pressure. High blood pressure is a powerful risk factor for stroke in the population, and trying to treat blood pressure as aggressively as possible will reduce the risk of stroke and reduce the number of patients having a stroke. So blood pressure control is vitally important. But there are also other issues that need to be addressed, issues around control of cholesterol, issues around good diabetes control, issues around smoking. So smoking does increase the risk of not only strokes, but heart disease and other diseases. So we have to address those factors. Obesity is linked to a whole raft of different medical conditions, including strokes.
Mrs. Filippo's family now understand how poor diet impacts health. The whole family is committing to a healthier lifestyle.
Change your diet, change life, the lifestyle. Yeah, more of a diet, especially coming from Polynesian family. It's changed, and it's made us think a bit more about our health, really. Because we don't really take it seriously till it hit Mum, like taking medications when you're supposed to. Just looking after yourself in general. It's cheaper to buy takeaways or whatever they've been eating here. I don't know what they've been than to have healthy food, you know. Just change your diet, really, because, you know, portion-wise, because we like to eat till we pop, but really you're supposed to eat just enough to live, you know. You eat to live, not live to eat. So we're going to end up like this if we don't look after ourselves. So big change to our family, like thinking more of the future, not just the present, which is important.
We're very so tall.
Yeah.
Most patients have a dramatic loss of strength after a stroke. Physiotherapists concentrate on getting them to transfer from a bed to a chair and then to stand.
Mr. Maxwell was originally a hoist transfer, so we needed 2 people and a mechanical hoist to help move him from the bed to his wheelchair. And we were working on the pivot that we did with him, but he didn't quite have enough power and sort of the planning of the movement to get from bed to chair.
Max is 102 kgs and is too heavy for his wife to manage. Physiotherapists are rebuilding his strength so he can transfer on his own.
I think he's got good room for even more progress as well. Yeah, he's got good potential to make some good gains.
Perfect. Lovely. 2 nurses help you at the moment to go bed to chair.
Yeah.
We try and get you strong enough to have just 1 nurse.
Yeah.
This is how we practice.
Whatever it takes.
Max is working hard. Like all patients, he will see improvements, but there will be long-lasting consequences of his stroke.
It really does depend on the brain's ability to recover and just given time. So some people do recover very well after a stroke, and other people who work just as hard at the recovery sometimes don't recover quite as well.
Well done. Did you find that second one a bit easier?
No. Oh, yeah.
Yeah.
I got a habit of saying no. Tyler's got a nice name, eh?
Hello, Iutita. Malo soy for malo. Malo soy for. Wow, we're ready to go if I got physio. Are you ready to do physiotherapy? All right.
2 months have passed. Mrs. Filippo's speech is still difficult. She may never walk independently.
Are you ready to go when you're ready to stand? And then you can lean onto the bed, all right? Okay, ready? Mago for you stand here. Kulay from here. Ready? Yeah. Gasiro, go up. Good. All right. Okay, so. Okay, all right. The green. What color is this? Langmea mata. Green. Green.
Though she speaks English, it's less taxing on her brain to do therapy in Samoan, her native tongue.
I count how many balls do you see? Tasi, Lua, Fa. Very good.
The brain can hopefully recover through what we call neuroplasticity. So areas of the brain that don't originally have a role in perhaps controlling her speech or her motor function, hopefully will be able to take on some of that role.
Yeah, very good. Okay. Yeah. Wow, so far. How do you feel about that session?
I feel fantastic.
Feel fantastic. Oh, okay, that's good. Yeah. Do you feel like what accomplished? Do you feel like you've accomplished a lot?
Yeah, accomplished less.
And where you feel more confident?
Where's more?
Very confident.
What's this?
Okay.
Yeah.
That's very good. All right.
Probably the most important thing is she needs time. The area of changes we can see on that scan are permanent and irreversible, but unfortunately Mrs. Filippo may still recover because hopefully the remaining healthy areas of brain will take on the functions that have been lost by the damaged brain.
Max has now been in hospital for 4 weeks.
That's a smaller one.
But it's still a huge effort to get into a car.
Yeah. Here we go.
Yeah, so just standing up.
Yeah.
Yeah, so when try and take that right foot to the side. You're turning your bottom towards the seat.
Yeah.
Good.
Yeah.
Yeah. So you can stick your bottom out, sit down, just watch your head. Watch your head. Good. In.
What a little car.
Well done. There we go.
I'm happy with what I've done, and with the sitting and standing and leaning, it's all under control. Easy peasy. No thanks to you.
10 weeks after her major stroke, Mrs. Filippo is leaving Middlemore Hospital. But she's not able to return to her own home. She's needing full-time support from her family. The community stroke team starts weekly sessions of physiotherapy, speech and language, and occupational therapy.
The commode that she was sitting on, the bed lever, the shower chair, and we had a handheld shower because she's got a bath at home.
And so all that's working out well?
Yes.
It's all the right sizes and it fits and everything's
Yes.
good and... Okay, cool.
She's a little bit slow.
Yeah.
Therapists assess Mrs. Filippo's progress and set new goals. Therapies will continue for months.
So next time when I come, I'll do a lot more. It can be a big shock when you go from being in the hospital where everything's done for you. The nurses just come around and they flit all about you and do all these things, and then you get home and you're like, no, I have to do it all. You have to do it all. So you've been home since Friday, 4 days. How have you guys found it?
100
Yeah.
and feel free.
Okay. So you like to garden. You like to pray.
Oh, I could pray. Pray, all of my center, he said, pray for me.
Is there a plan for when you'd like to go back to church? Would that be quite important to you, to get to go to church? Yeah. So we can make that one of her goals. So what we like to do is, over the next couple of sessions, we want to create a set of goals that are really functional and really personal, things that you want to work towards.
Max is still at the hospital and needs to make further gains before he can be discharged.
8, 9.
And how are you feeling?
Improving.
What's improved so far?
My actions, arm actions, I think a lot clearer. I used to stumble with words. And no, it's all on the up and up. At the beginning, I could barely move it, and through therapy, I can do a lot of actions, you know? Okay, Sandeep, thank you very much.
You're welcome.
Yeah, I'm very, very pleased.
Mrs. Filippo's speech is slowly improving. She's back at church for the first time since her stroke. Back in her community. Max is making slow but steady progress. He meditates daily and uses that practice to patiently accept the impact of his stroke. Regardless of what function returns, he and Mrs. Filippo both feel lucky to have survived.
I have no fear. Since I've realized that I'm not bulletproof, I have lost all my fear. Because I know I'm mortal. I never never thought that I was going to die until the stroke. And then I see all the trees and the leaves and they're so wonderful now. Good afternoon, sir. Good afternoon, ladies.
Don't even waste a second or a minute. You know, if you think that someone's having a stroke, if you feel that someone's face has dropped or their arm's weak or the speech has suddenly got worse, don't wait to see what happens to their symptoms, even if the patient is sitting around telling you, I'm all right, I'm all right. You call an ambulance straight away and get to hospital, because the chances of making a full recovery or a good recovery or a better recovery is much higher in those patients who are treated very quickly.
Okay, very good. She's putting a lot of weight through your hand.
Attitude was made with funding from New Zealand On Air.